Garza,
Here.
Dr. McBride,
Here.
Dr. Cunningham, Bishop Hankerson, Senior Bosman,
Here.
Dr. McGuire.
Present.
Okay, we have 4. So we have a quorum.
Yep. Okay, great. Thank you, and good to see everybody again on this warm July morning. So first order of business will be approval of the March 20th, 2026 meeting minutes. Those were circulated around by Melanie, I believe, earlier this week or last week. So everybody should have had an opportunity to review those. Are there, well, need a motion to approve, and then we can discuss if there's any edits.
Motion to approve.
Thank you,
I
Dr.
second.
McBride.
I second.
Second.
Okay, Cindy, a second. Any additions, deletions, edits? Okay, all those in favor say aye. Aye.
Aye.
Aye.
Aye.
Any opposed? Okay, the meeting minutes are passed. All right, moving on to our next agenda item, the census and supervision of the pretrial services population to date. So I'm going to turn it over to you, Director Ware.
Yes, sure. I've got Aaron Levin here to has a PowerPoint for all the stats. He's going to throw up there for you.
Yeah, since everybody's remote today, I'll just share it on my screen and it should share on the whole Teams meeting.
Hey, Aaron, could you go, go into presentation mode or expand the picture?
Is that good?
Yep.
All right. Okay, so so here are numbers as of Wednesday. I get them for as recent a day as I can. Population, jail population was 1275. Today it's 1279, so it's right in the same place. We have 777 who are on pretrial supervision. That number has continued to grow. And probation's about the same, a little under 2,200. That number's been stable for a while. For a total of 4,233 under all of DJS supervision. So for the incarcerated population, what you see here is a little bit unusual because the Q2 average for 2026 was actually lower than the Q1 average for 2026, because for most of April and May, the jail population was like between like 1,200, 1,210, 1,220, that area. And then in the last like 5 or 6 weeks, it's really shot up a lot. So the number that we have now is a pretty recent increase. I think over the last 6 weeks, it's gone up by about 50. For most of Q2, it's at in the low 1,200s. The race gender proportions here are pretty much the same as always. The 66, 22, there's nothing new here. The proportions haven't changed. Length of stay for Q2 was almost exactly the same as it was for Q1 and historical average in the 70s.
Can I interrupt for a second?
Sure.
Did everybody else have an interruption a minute ago?
An interruption?
Do you mean a decrease in the population?
No, I didn't hear what was said. I just sort of blanked out for a minute while you were talking, Aaron.
Okay, I don't know which part you want me to go over, but
No, that's fine. Maybe I'll just ask my question then. Is that all right?
Sure, go ahead.
Dr. Garza?
Sure, yeah, go ahead.
So you said there was an increase, and we can see it on the screen. Looks like about 120 or so relative to the historical average. Maybe you're going to go into why that is, or should I?
Well, the historical average goes all the way back for 5.5 years. So okay. I mean, historical average is going to cover periods where the jail population was in the 700s, 800s, 900s.
Good. Yeah.
Mathematically, it's going to be way lower by default. But we've been in the 1200s for two and a half years now. So that's, that historical average is just not, it's a good number to have for the big picture, but it's not pertinent to where we're at today.
Yeah, that's correct. We've been at about 1,200, as you can see in the first three columns. Okay, got it. Thanks.
Yeah, and Tim,
Hey,
if you
Aaron, I
remember
have a
that.
question with that one too. Oh,
Go ahead.
No, go ahead, Kanika. Go ahead.
no, I was just going to bring it up just as a reminder. I mean, going back 5 years in 2021, I wasn't there yet, but I do remember because of COVID, the jail population size was significantly smaller. So I'm wondering, I know historical average is great in some sense, but I'm wondering if there should be some separation now because times was different during COVID and the population was down to what, like 300 people, if not smaller. And I think that may impact the average. Go ahead.
Right. So I actually want to get to that in a minute. I'll show you guys, I don't want to take too much time on it, but I'll show you guys a new tool we have on our website that Dr. Cunningham might be very useful for going through that data and looking at historical comparisons. So if I can get more into that after I finish with the slides, if that's okay.
Yeah.
Sure.
Yeah, go ahead, Aaron.
Yeah.
Okay.
Thank you.
Average age at, this doesn't change much. The only consistent part about this is that it just ticks up a little bit every quarter as the whole population ages. Okay, charge status of the 1275, 1106 are pretrial. As usual, it's the vast majority. You can see high-level felonies, 373, 236, and 53. So we're at about, I think, 650 high-level felonies. And then for the low-level felonies, which is the one we really look at and zoom in on, we're at about 424. Things otherwise haven't changed much. Probation violations have ticked up a little bit over the last few quarters. They're at 117 now, whereas they tended to be in the between 100 and 110. But the proportions here haven't changed since last time.
Yeah.
Here's our focus on low-level felonies. 424 out of 1275 is about a third of the jail. And you can see we're a little higher now than we were on the averages for Q1 and Q2. But again, that's also a function of the population having gone up very quickly recently in the last 5 to 6 weeks. At least we're lower than we were at when we were at 488, which was our peak, as you can see on the chart. All right, for
Thanks, Aaron.
for the community supervision for pretrial, we're at 777. That number has continued to grow, which is a good thing. We're continuing to expand our pretrial capabilities. Some of the people also have a DJS GPS condition. Most of them are just on the standard pretrial release program. As you can see, here's the progression of how our pretrial program has grown since early 2025 when we were in the mid 200s. We were at about 250. Now we're at 777. So we've grown the capacity to do pretrial supervision by over triple in a year and a half.
Yeah, a lot of good work there.
As you all probably know, a vast majority of the people who are on pretrial supervision are low-level felonies. So 82.9%, these three categories combined, 644 out of 777. So the percentage of people who are low-level felonies on pretrial is a lot higher than the percentage of people who are low-level felonies in the jail.
Got it. Thanks, Aaron.
And for staffing and use of force, I know Director Ware will talk more about staffing, so I don't need to go too much more into this, but we are still dealing with staffing shortages. The number of open positions is still high. And use of force has been really low lately, which is good. We've been at a stable low point for about 8 months.
Okay, good. Thanks, Aaron.
I think, yeah, if anybody has any questions, feel free to let me know. I want to address Dr. Cunningham's point about looking at historical comparisons by sharing one thing on the screen for about 1 minute, and then I can hand it over to Ava to do her summary. Does anybody have any questions for me? Well, yeah. I'll address Dr. Cunningham's question first, but I just want to see if anybody had any questions on the PowerPoint.
Amy has a question.
I do have a question in regards to the use of force
Sure.
being down, and you also referenced shortage in staff. What can you attribute to the decrease, which is positive, in use of force?
I would say the decrease is due to the corrections officers doing a great job with their communication skills inside the pods and working really hard on being patient with the inmates and communicating with them on what they need to do and how they need to do it. And I've seen that firsthand by being up on the floors. And I think that's a huge part of it is, using great communication skills to make sure that their directions are heard and understood. And so we don't get to a use of force. Sometimes it does, and they are professional when they do it. So I think that's why that's happening.
Thank you.
Aaron,
You had a question?
yeah, if I could just jump in real quick. Aaron, as usual, great job on all this. Your work is so much appreciated. I just wanted to say that one of the things I often do is shadow this by going to the website and looking at what's on the website. I don't need to call it up, but maybe you want to take a look at the population dashboard that's online, because the daily population thing has a little bit of a glitch in it for 7/10.
Oh my goodness. We've been dealing with it.
Okay.
I know we've the last few weeks the dashboard did that, not on my side but on the technological side, the implementation has been very problematic. I think the website's been going through all sorts of issues. But I can see what's the issue, Tim?
Well, it looks on the dashboard like the daily population has dropped from 1,200 to 780.
I'm looking at that right now. Oh, in one day. Yeah,
In one day.
That's a glitch. For yesterday, as the correct population, then it went down 500 people. Okay, I can't change that right here because I need to be able to.
I know.
Thank you for letting me know. That is not something we want to have. Yeah, that is not correct.
Yeah,
All right.
just,
Thank you for letting me know. While we are on the website, I just wanted to address Dr. Cunningham's question real quick by, let me see where this share screen button is, by sharing a new tool we have on our dashboard. Got a lot of windows up. All right. Yeah, so we're continuing to put new dashboards on our website. Eventually, long term, there's supposed to be 12, so it's a long project, but I wanted to show, there we go. There's a new dashboard on our website called the Historical Daily Dashboard. I know some of you like to go back and look at population in the past. What this tool allows the user to do, it's updated once a month, so it's updated at the end of every month. And essentially, you can select a date, so anything from the end of last month all the way back to the beginning of 2019, and you can click on that date and it'll show you what the breakdown of the population was during that time, if it ever loads. Come on. There we go. Yeah. So this will change. You can go way back to get a different date, and you can see. And I created this because I get a lot of questions, both internally and externally, about, when was the population higher? What was it like 2 years ago? What was it like 4 years ago? So I think this is a good tool for anybody who's interested in looking back to seeing what it was. Dr. Cunningham asked the question about what the historical average was like, and as you can see, the reason why it's lower is because it was being pulled down by this period in 2021 to 2023, where the population was in the 700s, 800s, 900s. So for any of you who are data inclined, this tool might be of help to look at the history.
Right. Yeah, that's a great visual presentation and pretty much tracks with COVID. You know, it came on in early 2020. And so you can see that tremendous drop right there
Now,
with COVID
before
starting.
COVID, we were still in the 900s.
Yeah,
But-
yeah.
but
It was definitely
went
lower.
It went on down 200 residents in about 2 weeks, I think.
Yeah.
Yeah, as everybody got released. But I think that's all for me. I will pass it on now unless anybody else has any other questions.
No, I just want to add one thing on this graph. So, perspective wise, obviously I'm from the police department. So, coming out of COVID, we saw crime stats change and an gradual increase in the crime stats we were seeing out in the community go up. And this is about the same. We start seeing an increase, and then our crime stats in the county police kind of have been going down the last last year, a year and a half. And so we're still recalibrating what that looks like coming out of COVID and the post years from COVID. And so trying to get a new baseline. And I think what we're seeing in the patrol divisions kind of is similar to this graph. So
spike from TNN days.
Yeah, we've had different crime waves that we've experienced, and then things are, I think, starting to stabilize a little bit. So we'll continue watching this graph as well to see if it's about the same as well.
And I actually think you mentioned that it had gone down. It actually, even though it's still high right now, it has gone down because last July I guess it was September, we peaked at 1334. So we are lower than we were then, still at a high number, but lower than at the peak, which was about a year ago.
We also see an increase typically in the summer months. Crime typically goes up. People are out of school and home from college, and then just the weather and all kinds of stuff contributes to that. So we're likely to see the same here if there's more crimes committed in the summertime. So.
Right. And I think across the country, you're seeing a decrease, especially in violent crimes. If you're seeing that on the police department side as well, from the pandemic times.
All right. Well, I think that's it for me. I will note that glitch on the population dashboard needs to be fixed, and I will try to contact IT today, see if they can figure out what's going on there, because that's definitely not in the data. I don't know what's going on.
Thank you. I just wanted you to be aware of it.
I appreciate it. Yeah, I had not seen that. Population did not drop 500 residents in one night.
Yeah, I just want to make sure if anybody was doing that during the meeting, they didn't think that.
All right, thanks,
Hey,
everyone.
can make some funny quips about why that number decreased, but I'll refrain.
Yeah.
But thank you, Aaron, and thanks for all the hard work that you do bringing those stats to life. It's very much appreciated.
Yeah, I think the historical dashboard, the one that we just looked at there, the new tool, will be useful for those of you who like to look at the history and see when it's gone up and down. You can select any date in the last 8 years, and it gets updated once a month. So at the end of every month, I put the data for the prior month on there.
Okay, that's fantastic. Thank you, Aaron.
Sure, Ava, I will share whenever you're ready
Sounds
for me to
good.
share. Yep.
And I will wait. Dr. Cunningham, would you like to address the medical services contract, or would you like me to do that?
Oh, I am happy to do that one.
That's good.
Sorry, you all. I'm in the middle of driving. I want you all to see my chin while I'm talking. So,
Sure.
well, I would say thank you for all of the support from everyone on this call with getting us across the finish line. And so we were able to get that approved through an emergency meeting. And, we have been able to maintain our contracts, and we are continuing to move forward. So I truly appreciate all of the support. And I must say that Tim stepped right in day 3 and was right there by my side, getting the police departments, and the police chiefs were phenomenal, and also Dr. Garza and all the hospital systems. So we really appreciate the support. And so from our end, thank you so much. And our patients didn't experience any interruptions in care. Just so you all would know, I did send out updated letters to all of the residents at Justice Services, and then of course our pediatric parents and caregivers. They also receive updated letters, letting them know that there will be no gaps in healthcare, and thanking them for their support as well. So thank you
Hey.
all.
Okay. Hey, Kanika, one question for you, and this might be a little bit unfair, but how can we prevent this from happening going forward? So I'm assuming this is an annual contract. Is that right?
Yeah, it is. So the department, so these are Missouri co-op agreements, and so the county has had these particular agreements since like the 90s. Given that we do our budget on a yearly basis, what happened this year is the county council, they cut the funding to the contract, and honestly, they cut quite a few of my healthcare contracts throughout the department, like $4.8 million worth. So really, this honestly, it was political, and this was the county council, and I don't think they realized what they did, and I don't think that they wanted to take us serious because of everything that's going on. But last year, I spent 2.5 hours talking only about corrections medicine with the budget policy analyst. I presented some ideas on how I think that we can help reduce costs. And none of that, the only thing they took me up on was the use of the opioid settlement funds for some of our MAT work. But for us, it was a little frustrating because I warned them, like, this is serious, and we're 70% contracted, so we're very, very heavy on our medical contracts. So I just think it's the position of the county council that they don't prioritize healthcare, and and that's why I saw the cuts in the health department the way that we did. And I think for this one, it's just a matter of they didn't want to pay attention because we sent everything over in April. We tried to tell them before April, and they said they wouldn't entertain any transfer requests or any supplementals until the second quarter. And so that's when we sent it over the first week in April, and it sat on their agenda all the way up until everything happened the last week. And we sent emails. Dr. Page sent a letter of support that was not reflected on the agenda. I sent emails. I mean, on our end, we were communicating. I just think that they didn't take it serious, honestly, Dr. Garza.
Okay. Because I mean, just from an outsider looking in, I mean, this seems like it's a regular routine. Like, this is just table stakes business to execute contracts like this. So, yeah, whatever we can do to go ahead.
No, I was going to say the one thing that's unfortunate, the county council, they have the full authority to approve, deny any contracts, and even with the funding, like all of that sits with them. And so I think that's what makes it difficult, that, you have true work that needs to get done on the healthcare administration side, but then you have, this authority sitting with the county council. And if they don't understand or don't want to give attention to this priority, that they can hold legislation, they can do all of this. And that's the part, I think, for me, that was really disheartening during this process, was that they didn't take it serious, and they didn't understand, hey, you all have this authority. And I even said, pass it. We can talk about all the other stuff on the other end. Just pass the funding, and then we can go back and pick the pieces up or discuss whatever you all want to talk about. Just pass it so we don't have to get to this point.
Yeah. Well, hopefully we don't have to practice brinksmanship going forward. So thank you.
I agree.
Any other questions from other board? Go ahead. No, go ahead.
I have another health update before Ava. We are excited to announce that we will be going live with Epic next week for our electronic health records. Nice. On the 14th will be the go live throughout the department. I know there's some hesitation with corrections medicine, and Tim, I'll have to talk to you, but we're rolling out throughout the department. It's going to be a little bumpy the first few months whenever you implement a new EHR. It's always going to be bumpy. We're going to have staff, unfortunately, working from 2 EHRs until we get the full data integration complete. So that's other big exciting news for the health department, is that we will officially be on Epic come Tuesday of next week.
Yep,
can I ask a question about that?
Sure, go ahead.
Yeah, well, thanks for that, Dr. Cunningham. And I know Dr. Garza and others would probably know this, but I wasn't aware that was happening, but that seems pretty exciting. because and I realize that probably a lot of the people in the Justice Services Center may not have had prior coverage and all that, but to the extent that they do, and maybe we're an Epic or some other, one of the systems, one of the 3 or 4 systems we have, I assume that that will help with continuity of care. And
Yes.
that you can just really bring in, prior diagnoses and utilization, all that. I think that's a really big positive step forward. Am I correct about all that?
Yes, yes, you are. Yes. And our current EHR is, I'll just say this, it is horrible. Like we can't extract data properly. Patients don't have a good experience with it. So yes, the continuity of care, the data, the billing, and just a better experience for our patients with being able to access their medical records. It's so much. It's gonna be so much better. Like I said, a little bumpy ride the first few weeks, but it is. I'm excited that we're gonna be launching Epic.
Great, thanks.
Yeah, and separate but related, the medical examiner's office will be able to access those
Yes.
as well. And so
Yes.
it's really, I think it's the first in the country that
It's first in the world.
they're gonna, yeah, that they're gonna.
Yeah.
So, you can imagine with medical examiners doing a death investigation, they want to look at patient records to see, what their comorbidities were and things like that. And so now they'll have immediate access to that instead of having to request records and stuff. So
Yeah.
it's pretty cool.
That's the first in the world?
Yeah. They asked I think the question went to Dr. Norfleet if he wanted to name the module. So I don't know if he provided a name yet, but yeah, Epic themselves were actually excited about it too.
Well,
You called it, you know.
well, that's pretty interesting. Okay.
Okay, any other questions from board members for Dr. Cunningham before we turn it over to Ava? Okay, go ahead, Ava.
Thank you, Dr. Cunningham. And this is our quarterly update for corrections medicine. Back in March, at our last JSAD meeting, we promised you that we will provide you with an update on a dashboard. And we are at that point right now. But before we start, I just wanted to let you know that this is not a final product. So this is an update of where we are with our progress. You can see that we made progress. Aaron will be able to show his screen and show our progress with this. We had several discussions, and we believe that by the end of the year, this will be a finalized product available on the Justice Services side. It's dependent on data sets that will be provided and also work that needs to be done with IT. So last year in July, we presented to you the 10 new external data sets that we agreed on. We have 7 ready to go, and we will start people visits. And Aaron, if you can drive, I would appreciate it.
Yeah, sure. I mean, I can't zoom in on
Oh,
pictures,
okay.
Unfortunately. it doesn't allow you to do that.
Oh,
And this
okay.
is only on my computer. I guess I can actually, if you want me to like show each, like go to each tab like that, Ava, I don't know. There's different, like when it's in display mode like
Yes.
this. Yeah,
Let's just go back because I think
Okay.
it will be.
yeah, I agree. This is easier.
So we are looking at medical visits, and the yellow portion of that visit, of the bar, it's provider contacts with our patients. The blue portion, it's MA provided contacts, which is wound care, lab draws. We are still working on finalizing this particular graph. A future graph will include all the medical past patient contacts as well. We had a conversation yesterday and the day before. We believe that that would be a better representation of everything that's happening in the space, since there are multiple touch points during the day when we provide services to our patients.
But the MedPass data isn't quite ready yet to
Yes.
be included, yeah.
So that will be updated and we'll have a better understanding of that. The next, so if you look at dips in a graph, and we were trying to answer some of the questions that might come up. So when you look at dips in that graph, that's mainly related to staffing. And I guess all of the dips that you see on those graphs are related to staffing. Also, the increase in visits reflect the overall increase of population and also potentially decrease in justice services staffing, meaning that patients or our residents are submitting more sick calls and are asking to be seen in order for their opportunity to get out of the cell. And that was my thinking. So if there is any feedback on that, we would appreciate it. So we are moving on to psych visits. The purple portion of the bar is psych and fee patient contacts, and the pink is social work contacts. This particular graph does not include our psychiatrist encounters. And here again, when you look at these...
The psychiatrist just started within the last week, you also, that's why that's not reflective of.
Yes, and it will be reflected at the next quarter meeting. So again, when you look at dips, that's related to staffing. And again, the increase in volume is reflectant of increase in population and census. So we are moving on to unique patients.
Yeah, or dental visits.
Oh, yeah. So we are covering dental visits. And when you look at this particular graph, the numbers of factors are multiple. We used to have 2 dentists covering dental services in a building. One of our dentists retired last year. So when you look at those dips, it's also due to the fact that we didn't have full-time staffing. And we also had several issues in the dental clinic due to maintenance. But we've been having steady increase since. So.
Okay.
So we are looking at unique patients, and when we talk about unique patients, that's a single individual or patient, regardless of how many times we see that particular patient. And that is usually what is used in public health organizations, making sure that we evaluate the treatment that is needed and we are not inflating the numbers, the total numbers of patients seen.
It looks like if that was a ratio, it's about 1/3 of the patient or of the incarcerated population. Is that about right? 400 divided by 1,200.
Yes.
Yeah. Okay.
So the next one would be new MAT patients. We are still working on providing data for that one. I think we only had 3 data files, is that correct? That
For which one? MAP?
For MAT.
We have all the data for MAP.
Oh, okay.
It's the ones that are blank that we don't have all the data for yet. Yeah. So for MAP, we have all the data. For the one on the bottom left, transport for care, we have most of the data. That's why there's some blanks at the end.
Okay.
And then for the shift percentage for DPH versus the contractors, and for the substance use, those are the ones where we only had 3 months. 3 months worth of data. It wasn't worth putting up on there yet.
Mm-hmm.
So when we look at percentage of DPH versus agency, and that's not, we don't have a graph on that, but when we looked at our data files, we talk about average of 24 DPH covered and 76 covered by contract. So, and that's why it was even more important for us to receive the supplemental, for the supplemental budget request to be approved, because that is our workforce right now.
Yeah.
Any questions? I'm happy to answer.
I want to add just 2 things. Thank you, Ava. So just so you all know, we're actually in the middle of preparing for our budget submission as a department. It's actually due today. So I just wanted to highlight for this group that 2 of our priorities are going to be to continue to expand our behavioral health and substance use services. With the last jail audit report, they did comment to develop a true behavioral health program. So I hope to be able to build that out and maybe use some of the opioid settlement funding to continue to support growing that program. And then the second part, and we've always discussed this, but I am going to put into the budget a full-time dentist that will be assigned to corrections medicine, including juvenile. So I'm also trying to put that into a mental health and substance use type program, just given the number of individuals that we do, treat for substance use. And then also I can likely offset some of the salary using opioid settlement funds and some of the additional staffing support so that we can get this dental program up and going for our residents at the jail. So those are two priorities that we're currently going to end up budgeting for as we, submit our budget for today. And then my budget goes to Dr. Page, and then Dr. Page presents the overall budget to the county council. But those are going to be our priorities, of course.
Thanks, Kanika. Dr. McBride?
Yeah, thank you, Dr. Cunningham. That seems important. I just want to call out or ask you a question as well on the behavioral health issues, mental health issues. My memory suggests from prior meetings that a really high percentage of the people coming into the jail have mental health issues. Do you have in your head what that number is? Because I think this is really important that you're doing this.
Are you asking me or Ava?
Whoever can answer that question, or maybe somebody can remember from our memory. I thought that a pretty high percentage, over 50%, maybe even higher than that, have some mental health.
It was, Tim. Yeah, it was. I can't remember when we pulled that number, but I do believe it was probably close to 80%. It was a high number, and we did report it out. I think that was last year, but it was definitely a pretty, maybe 75, 80%. It was a significant number.
It is higher. I think Tim is asking partially because that's a metric that we used to show on our old corrections medicine dashboard, which is defunct now. I mean, I am totally open to re-including something like that on this dashboard. We just have to make sure we do it with accurate data. The reason that those old dashboards were retired was because we had, we didn't have high confidence that the numbers were correct. So
okay.
I'm sorry?
No, I'm sorry. I think my phone cut off. Go ahead and finish your statement. I'm sorry. I didn't mean to interrupt.
Yeah, if that is something that we are able to eventually collect reliably from the corrections medicine side, I have no objection putting it back on the dashboard.
Correct.
But yeah, I don't want to.
I was gonna say, I think for Aaron, I don't know if it'd be one of two. I have one thought here. We will be able to pull better data from Epic. So I think that's going to solve the major problem, because Allscripts, just unfortunately how it was just so clunky and an archaic system that we couldn't pull accurate data. And so one thought would be either, Aaron, we get you access to be able to get the data, or Ava will have to train our staff to be able to pull those data metrics. But I do believe with Epic now, we should be able to pull accurate data to report out on these dashboards.
Yeah, and I'm happy to do as much of the data lift for you guys as you'd like. I am happy to do that. I just, after looking at the numbers over the course of several years from the last time, as you said, Dr. Cunningham, it was clear that some of the numbers coming from the old database were really goofy. And this is why we wanted to rebuild the dashboard from scratch with numbers that we knew we could rely on.
And as Dr. Cunningham said, with Epic, we'll be in a better place of running reports, to providing that accurate data, and then we'll be able to share that as well.
Sure.
Yeah, if I could just jump in again, thank you for that. My memory was that it was like 75 to 80%, but thank you for all that dialogue, and I was going to ask why the corrections dashboards online were not available, but now I know why.
They're done. You can't look at them anymore.
Yeah, that's.
We need to take the links off the website, but you can't view them anymore.
Yeah, that explains why. But I think the point was made that the number is very high, and I didn't want to overstate it by saying 40 or 50%, but my memory was that it was closer to 75 or 80%. So the services that you're talking about implementing are crucial, because as Dr. Garza and others on this call know, and the board, there's just a lack of mental health services in the community. So this is, it's just being reflected in this population, I think.
Correct. And I'll just add a couple of comments to support yours, Dr. McBride. So the population in the jail, of course, has a higher percentage of mental health and substance use disorder than the general population, as well as chronic disease. And so it's a challenging population for medical services. So I think the investment in psychiatric support, behavioral health support, and the dentist, I mean, believe it or not, poor dentition does contribute to poorer health overall. And so that is a worthwhile investment as well. Okay, any other questions for corrections medicine? Okay, thank you. All right, so let's move on. Thank you, Ava, and thank you, Dr. Cunningham. Next item on the agenda is the director's comments and issues. So, Captain Ware.
Okay, thank you. First, our hiring strategies update. So since we've been here, we've been working with our human resources department consistently, weekly meetings, and we are full steam ahead with everything they've got, strategies wise and hiring wise. We've posted every vacant position that we have is open for hiring. We're developing a few new ones, like an experienced officer posting that we're kind of stealing that idea from our police department to be able to try to recruit experienced officers in a different posting to justice services. We're currently probably closer to the end in quite a few of them, and being able to hire all kinds of positions. And this goes for not only corrections officers, some supervisor positions, and then also some non-correctional officer positions that have been vacant and that we're gonna do hiring on. So we're moving full steam ahead with that. I've been very happy with our HR department. They're doing a great job. When we meet with them, we have 3 or 4 people in the room with us, and we're able to talk in the room together, and we've been able to get a lot done. So I look forward to seeing the results of that in the very near future. I obviously understand staffing is a huge priority here, and we're working very hard on that. We also have a new academy class right now that's finishing up week 1 of their academy. There's 19 recruits in that academy class, and so far they're all seem to be doing pretty good at the end of week 1, so that's encouraging to see. We're working hard with this new academy class. A big component is not only recruitment but retention, and retaining these recruits and retaining our current corrections officers to be able to maintain our staffing levels. And so we're working, I'm not ready to announce a couple things yet, but we're working on some stuff on how do we retain. We're looking at the training department and making sure we're training our recruits the right way. And we're also looking at our current staff and talking with them and seeing what needs they have and how we can support them better. So no one's getting frustrated and we're able to retain the employees that we do have. So we're working very hard on both ends, the recruitment and retention. We've got a lot of people working really hard here, extremely hard, and we've acknowledged that multiple times. We try to get on the floors as much as we can to talk with the corrections officers and remind them that we're here to support them. And we're going to need everybody's help when these new recruits come out of the academy to be able to support them on the floors and provide some mentorship to them. And it's going to take everybody, a little piece of everybody, to help these new recruits out, because we desperately need them. And that goes for anyone new, non-corrections also. It's going to take everybody to really welcome everybody in and support them and make sure if they have any questions or they don't feel prepared in some way, that we get that corrected as soon as possible. So I'm excited about that. This is our first academy class, so we're just kind of experiencing it along with them. And I think as we see a need to make adjustments, we'll make adjustments. and just to make sure ultimately they feel prepared when they get out on the floors to do the work. Lastly, the Wi-Fi improvement update. We met with HomeWave, who provides our Wi-Fi, and they, over the last month, have been working on some solutions, and they have doubled the speed of the Wi-Fi for the inmates. And then they were working on one floor, and then they added the fix to all the floors. So the Wi-Fi should have been approved. That happened about a week ago, I guess, maybe a week and a half ago. And so they've been able to double the speed on that. So the tablets for the inmates should be working better, and the access to the internet should be way better. So I haven't heard any complaints of late, but we'll check back in on that just to make sure. We have a great relationship with HomeWave, and we were able to meet with Jim DeCenzo from HomeWave, and we had a great meeting about that. So hopefully we've gotten past that to where we've gotten that fixed. And so those are the three main updates I have for you today. If you have any questions on that, please let me know.
Great. Thanks, Captain. Senior, you have your hand up?
Yes, I do. Thank you, Captain Ware, for that report. You referenced you're seeking experienced officers. In comparison to what? How does that differ from your current array of officers?
Yeah, sure. So what we found is if we're able to put in an experienced officer post out there and the salary is adjusted, we can make some salary adjustments for that, and we can bring them over hopefully at a similar or hopefully higher salary than what they would be currently making. Then that would be an opportunity for us to hire them, do a shorter training. It's kind of just maybe a retraining. Let's say if they come from another institution and they have 5 years on there, and they see this experience post, and they can see that they can make a change to this location at a similar pay raise, then they've got that 5 years experience there. We'll look into each one of them and make sure that experience is substantial or what we're looking for, and then we can bring them over, and they don't have to go to the academy. We can do a shorter on-the-job training with them, and then they'd be ready to go. So it's just bringing over experienced people that have similar experience to what they have here at a higher pay range, and it's going to be equal to what we have here in that range, and then we would be able to get them on the floor a little faster.
Okay, thank you.
Would that be at the, is there a different sort of job description for that then, Captain, or is that like a different job?
No, it's separate from we have a corrections officer posting that's up there now,
Yep.
And this will be a complete separate one. So they'll
Gotcha.
see two different postings. So if they're already working in the field and they're looking to change, they can apply. And if we find one that wants to come and maybe their experience level isn't what we wanted, we can still
Yep.
hire them and send them to the academy. But then if there's others that do have the training and experience that's necessary, we can hire them and do a shorter on-the-job training.
Gotcha. Okay, great. And I'm assuming that the ecosystem for this particular job is still pretty challenging around the metro for recruiting and things like that. Is that still correct?
It's highly competitive. It's similar to the police departments. You know, everybody's fighting for the best people. And so it's a matter of the culture that we have here when we get them in the door, and the resources and the benefits that they have. We have to really do a good job with advertising those and making sure that they're aware of what we have to offer. And then knowing, you know, word gets out, hey, I want to go work there because the culture's good there, and they treat
Right.
you well, and we're working on all that stuff.
Yep. Okay. Great. Other questions from board members? Okay. And remind me, Captain, how long have you been in the seat?
Not quite a month. I started June 15th, so almost a month.
All right. Well, a ton of work in the last 30 days. So thank you for all your hard work.
Sure.
Yes,
Okay.
thank you so much.
You're welcome, Dr. Cunningham.
I told, just so you all would know, I told Captain Ware, I was like, you know, we're gonna be besties, right? The DJS and DPH directors work really close together.
That's good.
Yeah, yep. That's how it all comes together. Okay, great. Thank you so much for that report. All right, so moving on to our next agenda item, we have public comments. So Melanie, do we have any public comments?
There were no public comments.
Okay, fantastic. All right, so let's set our next board meeting and agenda items. So this is where we all consult our calendars. And forgive me, but typically don't we have this on the either the third or fourth Friday of the month, if I remember correctly?
Typically you do, but it's been switched around due to like.
But Senia, you're out of town like every fourth Friday, right?
Yes, the Friday of every month.
Okay. Last Friday of every month.
It's the
right?
last Friday of every month.
Okay, so I'm looking in the October timeframe.
You cut out there, Alex. What dates are you asking about?
Yeah, getting a lot of disturbance on the audio now.
I think everyone besides the speaker might need to mute.
Yeah, still getting a lot of static. There we go.
It seems like it's coming from the conference room because
Yeah, I
once you
think so.
unmuted, it went away.
Yep. And it might be that plug got loose a little bit earlier in the meeting, and so I'm not sure if that had anything to do with it. But anyway, so Sini, you were saying something about dates?
Yes, I was just saying that the end of every month, the
Uh-huh.
last Friday.
Yep.
I'm generally traveling.
Right. Okay. How does October 23rd look to everybody? Okay, got a thumbs up
I
from
will be out of
Senia.
town. I will be out of town October 23rd.
And I'm not able to make that either.
Okay. How about the sorry, let me take a look here. I'm looking at my calendar now. Jeez. October is kind of a mess. Would the 16th work for everyone? If not, we can go to November.
I can do the 16th.
I'm not available the 16th.
Oh,
That was a thumbs down from Tim too.
no, that was a thumbs up, but it's Senior.
Oh, okay.
Senior said no, I think.
Right. Okay, well, let's take a look at November. How about the 6th or the 13th? Either of those work for everybody.
Neither of those works for me.
Okay.
Neither of
I'm
them works
okay
for
either of
me
those
either.
dates as well.
All right, trying to avoid holidays now.
Yeah, and Veterans Day is on the 11th. I don't know if that makes a difference if that's on there.
Yeah, I think somebody in the boardroom is speaking, but I think you're having problems with your mic. So
Everything else is there.
there you go. All right. Very good.
You're good.
Okay. All right. So 1, 2, 3, 4. Is October 30th work for everybody? See, I know that's the last Friday of the month, but I don't know if it
Yeah.
was like, because there's 5 Fridays in the month.
Right, October 30th doesn't work for me, but if I'm
Okay.
the only one, then I understand
does-
you'll need to move forward.
It
Sure.
doesn't work for me either.
Okay. So I think,
All of those days work for me so far, so.
okay. All right.
Just for the record.
Just for the
Yeah,
record, you're
no,
not the
appreciate
trouble.
that. Yeah. So sound like I'm getting all my dates mixed up. So was the 16th where the majority of folks could attend? Or am I daydreaming here?
Is that October or November now?
Yeah, October, sorry.
I'm available October 16th.
I am available.
Okay, and Senia, you're
I'm
lone person out.
traveling on some other business on that day, but again, you know,
Okay.
it's
Well,
okay.
let's go ahead and pencil it in for the 16th. And we'll go from there. Okay. And then Melanie, if you could just send out an invitation to everybody and then.
Yes, I'll put one in today, and then if we change it, I'll send an email stating.
Okay. Okay, great. All right. So in addition to the standing items that we have on our agenda, are there any other items that the board would wish to discuss?
So did I hear there was from Dr. Cunningham that there was a budget being written right now?
Yeah, all of the county departments, we're all working on our budget, and then we submit our budget to Dr. Page. Dr. Page normally presents the county budget sometime in September. So October, that maybe if you want to have the budget discussion for both Captain Ware and myself, I believe, you know, we'll be able to discuss at least the budget presented by Dr. Page, but the council typically don't approve the final budget until December.
Yeah, I think
Correct.
it might be a good idea to have a budget presentation then. Sounds like it might be good timing.
Okay.
Yeah, and you should have your budgets finalized by then, Kanika, or when do you
Yeah.
when do you need to submit them to the council?
Oh, well, Dr. Page submits it to the council on our behalf sometime in September.
Okay.
Yeah. Yep. So
Okay.
So when we present in October, that will be the presented budget we can present
Right.
on.
Right.
Yeah.
Because we don't know what they will approve.
Yep.
That'll be fine.
Yep. Okay, great. Diane? Dr. McGuire, you have your hand up?
I do. As you know, I was contacted by the host for a comment about some issues at the jail, and I just wanted to know if there's maybe an email we can refer people to when things like that happen, because I'm assuming none of us should be speaking on behalf of the board with the possible exception of Dr. Garza.
Yeah, so thank you, Diane. So I think that would be a good, I knew that there was a couple of articles that came out here recently regarding the disturbance earlier in the year about some of the findings. So let's go ahead and put that on the agenda. If we could just review those findings. I think Captain Ware, you had discussed that with the newspaper.
Yeah.
And so if we could just have an overall review of, hey, this is what happened. This is what we're doing to, improve conditions to reduce the likelihood of this happening, things like that. I think that would be a good agenda item.
Sure, no problem at all.
Okay.
And if you do get requests from the media, I mean, you can refer them to me and I can refer them to the county executive's office through our, point of contact there, and what we handle it that way, so.
Okay, great, thank you. One other thing, Captain Ware, that we had before, could we get an update on any maintenance issues with the facility as well?
Well,
not today, but in October. Yeah, in October. Yeah, for an agenda item.
I thought you were gonna put me on the spot now.
No.
I know several, so I'll give you a good update next meeting for sure.
I've learned from the counselor's office that we can't bring up anything that wasn't on the agenda. So
We appreciate that.
yeah. So I think those are some pretty weighty topics. So we should have a good meeting in October. Yes, Senior.
Sounds like a great meeting, and I apologize if I have to miss, but I will be traveling and in the airport, and if for some reason I can call in.
Sure.
I will do that. So Melanie, just make sure I get the invite.
I'll make sure you get it sent an invite.
Okay. Thank you.
Mhm.
Yeah, and along those lines, just as a sort of housekeeping, I know that there was some confusion with logging on today. So I know I had two separate invites. One was for the general meeting and one was for a participant. So if we could just send the participant invite to the board members, I think that would help alleviate
This
any
is the
confusion.
This is the first time they sent one out since we moved to Teams, so
Right.
it's
Yep.
better they, I will discuss with IT and we'll
Yep.
try to get better for the next one.
Yeah, no, totally fine. Not a complaint. I know that there's always an
Oh, no,
adjustment
yeah.
period moving over to a new platform, but
Sure.
I will say I appreciate you moving over to Teams. So,
Good.
so that, yeah, so that is much easier than going through
Good.
Cisco. Okay, great. Well, thanks everybody for the great dialogue. Have a great rest of your summer and we will see you in the fall.
We need a
Please.
motion to adjourn.
Bye-bye.
Oh, I'm sorry. Yep.
So moved.
A motion
Thank
to
you.
Thank you. Thank you, Tim.
Second.
I think Diane made the motion, Tim seconded for the minutes. Any opposed? Okay, everybody have a great summer. We'll see you in October.
Thank you.
Great. Thank you. Have a great one, everyone.
Likewise.